Hi, welcome to your Checkup. We are the patient education podcast where we bring conversations from the doctor's office to your ears. On this podcast, we try to bring medicine closer to its patients. I'm Delesky, a family medicine resident in the Philadelphia area.
And I'm Nicole Aruffo. I'm a nurse.
And we are so excited you were able to join us here again today. So before we were recording, we were talking. Let's pick up right where we left off.
Oh, yeah. I said we should get a sauna.
And these are all the rage now.
Yeah. I mean, not in this house, but like when we move to the suburbs and have room.
Sure. I think I could, excuse me, I could see a lot of places for a sauna. In Mike's house, I could see it. In his like back
in the
basement dungeon. His basement isn't a dungeon. We've mentioned this basement before on this podcast. His beautiful man cave. But behind the closed doors, put a sauna in there. This recently came to light because we had that one patient who came back and saw me, and she was like, yep, my husband, beautiful man. If someone clipped this out of context, that'd be funny. My husband, beautiful man. He bought me a sauna, and I'm sitting there, peace in my zen, and I'm listening to your podcast, which I thought was a huge compliment.
I saw they have them at Costco, actually.
Do they really?
Mm-hmm.
Too bad we're Sam's Club
I miss
people.
Costco. I know. I want to go back to being Costco people. Costco is better.
I was never a Costco person.
Well,
what's the big difference? Like what?
Well, Costco is the superior store, and that's that on that.
That's just the final word. What do you think, Ollie? Hot take from the intern. He thinks Sam's Club better.
He didn't say that.
In fact, he didn't say anything. So Ollie goes to the groomer. He's been to the groomer once, and it's a doggy style right down the street. And we met this guy. Well, tell us what was his name? Well,
his name is Aiden.
Yeah, and we can use his first name because there's no reason to not.
We call him Uncle Aiden.
Yeah, so because Nikki is a little nervous, we went back and we watched the entire grooming session. Now, some people...
Yeah, I did. I paid $10 extra to do the owner observed session. You can't trust people.
Well, they were a little disturbed by that up front.
I don't care. They offer it, so that's what we're going to do.
And you paid for it, so we just paid to make his life more uncomfortable. But this guy was great. He was super nice to Ollie. He was very gentle with him. Now, mind you, this was months ago. This was before his surgery, probably obviously last year now than January, but before the summer. I don't know when it was exactly, but it was a long time ago. But this guy made such an impression that we keep thinking about Uncle Aiden, and just kind of walking by not the grocery store, walking by doggy style pet shop. I wonder if that guy's working in there. And he kind of had a curmudgeon manager.
Yeah, he did.
And this guy's just out here trying to groom. But he's a multifaceted man.
Oh, my God.
Because we go to Trader Joe's, and we're in the line waiting to go, all these people are standing there, and they're they hold up the sign, and they're like, yo, number 14, number 11, I'm going to check you out. And there we see him. I see this figure with a similar silhouette, similar height, weight, build. I'm like, Nick, is that Uncle Aiden? And this man, sure, he could probably have multiple jobs. I don't know if he's working at doggy style anymore, but there we saw him after months of wondering where he was. And he was probably thinking about Ollie. Now, he didn't check us out that day, but we felt compelled to tell him about everything that Ollie's been through.
Yeah. Well, he did say when he was grooming him, he was like, Ollie's way better behaved than this other corgi that he also grooms.
Yeah. So we of course knew that Ollie, who is snoozing right next to us, is way better than the neighborhood corgis.
Maybe we could take him to get his nails cut or grinded. I hate cutting his nails.
Why do you hate cutting his nails?
Because the ones that are black and you can't really tell where the quick is, so you have to do it one little sliver at a time, and every time you snip it, it's oh, is this going to be it? And I'm going to make him bleed.
Has this ever happened to you before?
Only once. And it was the tiniest little bit, and he didn't even cry or anything.
So he ended up being okay?
Yeah. I was not, and that's all that matters, so.
Sounds like we're going to get his nails cut at the groomer.
But they do the grind, They like grind them instead of cutting them.
I mean, that's a quick thing. Look, these groomers are not cheap, I'll say. He's worth it. He's so worth it. But do you think they'll just...
Or we can just take him back to the surgeon's office because they always cut his nails.
It was like, oh, can you just check him out, make sure he's okay? And then they like offer complimentary nail cut. Yeah, so that's about that. I think we're at our just about 5-minute mark. Was there anything else that you wanted to jump in? I'm very sorry that normally Nikki is able to look over with an iPad and she can scroll through the notes and make...
Yeah, but someone didn't charge it.
No, I didn't.
It's been sitting here dead on the table during our whole PTO week.
Dead on the table. It's about I think it was like 2 weeks. All right, Nick, what are we going to talk about today?
Yeah. Today we're talking about something that's been getting a lot of buzz lately. The new strain of bird flu. It's all the hot goss.
It is the hot goss. And, reasonably so after COVID. I think when people hear about a contagious disease, people get nervous.
Yeah.
And there's a lot of stuff that gets put out in the media.
Yeah, everyone's freaking out that there's going to be another pandemic.
But the headline is that I think we're okay.
Yeah.
From the bird flu. So we're talking about bird flu, like we said, because it's,
Because it's trending in the media.
Yeah, it's trending in the media. We think it's important to stay informed on emerging health issues. And, this bird flu, as they named it, it's called H5N1. It's normally a virus found primarily in birds. And there was a case that was recently discovered in the United States that was severe in nature. And so we're going to take some time today and we're going to kind of dive in and talk about what things to think about, what all of this kind of means, and what it can mean for you personally, how to protect yourself, your loved ones, or
your neighbors.
Nikki, can you guide us through and talk to us a little bit about what the H5 bird flu is?
So it's caused by bird influenza type A, and it's shed in bird saliva, mucus, and feces. So if a bird poops on you,
it used to be good luck, but not anymore.
Watch out. And they're spread by other infected animals through respiratory secretions and other bodily fluids.
So we talked about how the virus is transferred from mostly in birds to other animals, but what about humans?
Human infections are very rare.
Thank God.
And there's not a human to human spreading.
Yeah, that's rather rare.
Mm-hmm.
So we're here in the current situation in the United States because this is something that's been in the emerging media. So a severe case of H5N1 was discovered and confirmed in Louisiana, and it was linked to backyard flocks. So this is a little bit of in the weeds information, but the virus in Louisiana is the case of a D1.1 genotype, which is different than the one found in dairy cows. The significance of that may not be so relevant to you listening here today, but other information includes that up to the time that we're recording, there are 66 confirmed human cases during this 2024 outbreak, and the H5 bird flu is really widespread in wild birds worldwide, and there continue to be outbreaks here in the United States based in poultry and U.S. dairy cows as well. There are sporadic infections detected in other mammals, but like Nikki said, thankfully, there's really no person-to-person spread. So that's human-to-human spread of the H5N1 bird flu. And so what they're seeing here, all this information that we're getting is that the U.S. is monitoring it, and specifically the CDC, and finding no unusual bird flu activity in people, which is great because we don't need another viral infection causing a lot of problems. So take us through this information's as of December 2024. Just what are some animal statistics that kind of show how common this is in animals?
All right, a couple little statistics because we love a statistic. Starting off with our lowest number, just a touch over 900 dairy herds were affected in 16 states. And then we have almost 11,000, 10,917 wild birds were detected in 51 jurisdictions. And then the poultry.
Jeez.
So in 50 states, there were 128,907,392 affected poultry.
That's a lot of birds
in the U.S.
That is a lot of birds. So really talking about who is at higher risk, and I mean, this is the stuff to listen to if you haven't been listening already. Who is at higher risk? Those people who work or have recreational exposure to the infected animals. So these are backyard flock owners. We know one.
We do.
We do know one. Hunters, bird enthusiasts.
He brought one of the flock in.
Oh,
Christmas, remember?
Oh, my God. He did. Yeah.
We turned around and my cousin was just standing there with a chicken in his dining room.
Wow. Yeah. It was the chicken. That was good, right? You like that?
Yeah, it was great.
And people who have direct or close contact with wild birds, sick or dead poultry. And so this increases the risk of, an exposure. And that's what has been detected in these cases that have been found so far. So how to protect yourself. This is where the money is. There's a lot of routine stuff in here, but we're going to go through step by step about the things that you can do to reduce the chance that you're one of these very, very rare instances that end up getting bird flu, God forbid. So why don't you take the first one?
The first one, which is kind of like a no-duh, it's avoiding exposure. Best prevention is avoiding exposure to affected animals. Like, yeah, obviously.
Sure.
If you want to avoid something bad, you avoid the exposure to that thing.
Well, to jump on top of that, you avoid wild birds specifically. Look at them from a distance. And actually, be a good citizen. If there's a sick or a dead bird, I don't know how you're going to determine a bird that's sick, but if there's a dead bird, let someone know about it. Who? Not exactly sure. I think the CDC does have a phone number.
If you do need to come in contact with these animals, they recommend wearing some personal protective equipment like gloves, eye protection, and a good old N95.
Wow, bringing them back. I do think when I was reading to prepare for this that they suggested that like the people you call may direct you to get rid of the bird. So you may be called on a, civil duty to get rid of an infected bird. Hopefully not. So the next thing is to avoid touching surfaces contaminated by infected animals. Basically, their saliva, mucus, or feces. So a lot of avoidance here. Like we said, no rocket science here. A lot of people are facile with this stuff from COVID. Oh, but you, eeny, meeny, miny, mo, you got the good one. This is actually, I think a lot of people, this came into my mind when we were thinking about it, making this episode. And I mean, you can't help but think that like there's poultry and dairy we're talking about. So tell us a little bit about food safety.
Yeah, I mean, this is also just like basic food safety to avoid raw milk and products from infected animals. We're cooking our poultry and eggs to 165 degrees Fahrenheit, which until I read this, I didn't realize there was a cooking temperature for eggs. Apparently there is. I don't know. Might have to do another little deep dive on that. I've just never heard that before. Have you?
Not specifically a temperature. I think that's tough to capture.
Yeah.
With it being in a shell and stuff. Am I dumb?
Well, if it's cooked out of the shell.
Pardon me, because we've been eating hard-boiled eggs every morning for like 2 months.
Take the temperature of our eggs tomorrow?
Yeah, let's do it.
But we put it in an ice bath.
We do. Do we even have a thermometer like that?
I don't think so. Oh, I don't think we do.
No, Mike asked if we had one. I said no. For the listeners, let's keep going.
Okay. And then cook beef thoroughly and separate raw foods from cooked foods. Like duh. That's like what you do anyway, but just be a little more diligent about it.
Yep. The only thing I would add is that because we talked about those dairy cows, milk also comes from dairy cows. And with great certainty, the pasteurization process takes care of any potential infections in there. So recently we are choosing pasteurized milk, which I don't know why anyone wouldn't be. I'm sure there's people love.
There's a whole side of the internet of people who love unpasteurized milk.
Well, when it comes to this, we're choosing pasteurized milk. Great. I'll take the boring one, but always important is hand hygiene. So we are washing our hands with soap and water, especially after an exposure to animal or animal products.
Do you ever you never get sick except for that one time, last week. But I feel like sometimes if I like have a cold or something, I'm always like, oh, this is definitely from that one time I like could have washed my hands and I didn't. This is what got me sick. Yeah.
Really? No, I do have this nagging cough from that one time, but I can't pinpoint where I got sick from.
I mean, it's not like a pinpoint. Like, I'm just like, oh, I should have just washed my hands more.
Okay, so it was an important one. It's like not sexy, but it's probably the most important one on the list. So, Nikki, what are we going to do? We actually do have the information here. What are we going to do if you find a sick or a dead bird?
Well, we're going to avoid it or try to avoid it.
Shun the bird.
Then we're going to call our probably state authority. Oh, there is a state vet. Oh my gosh, this is like not state veterinarian, or you call the feds.
Call the feds and the dead bird carcass outside your house.
We do have a number here. 1-866-536-7593.
You made that like a jingle. That was great. We got to put you on a billboard or something.
Oh my God. And then it looks like you said earlier, they might instruct you to get rid of the bird. So don't go rogue. Wear some gloves, some eye protection.
Here you are, whimsically being a good citizen. You're like, I'm going to call and someone's going to come pick up this bird. And then they're like, psych, this is
your job now.
You're the one picking up the bird. Jesus. Oh, man. I'll take this next one. So our next topic is what to do if you've had contact with an infected bird or animal and become sick. So the CDC is actually recommending that you isolate at home for 10 days, which is a long time.
I love that.
I would say take that up with your own doctor. Avoid work or school until cleared by public health officials. Contact local, state, and health departments and a healthcare provider. And there may be H5N1 prescribed antiviral medicines. I haven't read too much about that. This is from the CDC website. I didn't really dive in too much.
Do we know what an infected animal might look like? Did you find that anywhere in our reading, or you can cut this?
Well, the actual symptoms of H5N1 bird flu are fever, feeling feverish or chills, eye redness or irritation, respiratory symptoms such as cough, sore throat, runny nose, muscle or body aches, and tiredness. So basically like the routine flu symptoms.
In an animal?
But in an animal, I don't know.
Oh.
I'm not sure. Maybe we have a vet on next time. And a quick word on treatment that a healthcare clinician may consider. They may use antiviral treatments, and it may be of the ilk of a Tamiflu or oseltamivir. But of note, vaccination for the routine seasonal flu vaccine won't protect against the bird flu, but it does decrease your risk of actual, human influenza. And so generalized recommendation is that like you should get vaccinated for the flu. Yeah. And you can listen to our old episode about that. The U.S. government will develop the vaccines. I mean, as we saw with COVID, they flipped that around real quick to be able to do that.
Don't get people started on that.
Well, we're not going to rev that engine here. So overall, in conclusion, I just want to reiterate that this is a public health risk, but it remains low overall.
Yeah.
And it's
all going to be okay.
We think it's going to be okay. The awareness is important. And this was, I should have dated this episode when we did it initially. It is January 5th, 2025.
Yeah.
I haven't said the year yet. And so keep looking at the CDC resources. You're probably going to find a lot of stuff online that may push you in one direction or another.
Everyone's freaking out.
But
it's going to be fine.
Look at the CDC. We think it's going to be okay. And so thanks for coming back to another episode of your Checkup. Hopefully today you were able to learn something for yourself, a loved one, or
a neighbor with the bird flu.
Of which there are only 66 of them currently.
If you know one of the 66, that's pretty cool.
That must be pretty cool. And so we look forward to having you back next time so you can learn more about health and wellness and other topics, maybe current event or otherwise. Please follow us on Instagram, find us on TikTok, send us an email, yourcheckuppod@gmail.com. And we look forward to having you again next time. But until then, stay healthy, my friends. I'm Ed Delesky.
I'm Nicole Aruffo.
Thank you and goodbye.
Bye.
This information may provide a brief overview of diagnosis, treatment, and medications. It's not exhaustive and is a tool to help you understand potential options about your health. It doesn't cover all details about conditions, treatments, or medications for a specific person. This is not medical advice or an attempt to substitute medical advice. You should contact a healthcare provider for personalized guidance based on your unique circumstances. We explicitly disclaim any liability relating to the information given or its use. This content doesn't endorse any treatments or medications for a specific patient. Always talk to your healthcare provider for complete information tailored to you. In short, I'm not your doctor.
I am not your nurse.
And make sure you go get your own checkup with your own personal doctor.